So let's talk about amphetamine and methamphetamine. Amphetamine is a race mixture of both D and L isomers, sometimes referred to by their street name bennies or speed. Methamphetamine can be known as meth, crystal, crank, speed, or ice, and it is more potent than amphetamine. From a mechanistic standpoint, there are three that you need to be aware of. Basically, it blocks monoamine reuptake into the presynaptic nerve terminal, and this affects the neurotransmitter concentrations of dopamine, norepinephrine, and serotonin, which is shown here. It also increases the release of these neurotransmitters from the nerve terminal in a calcium-independent approach or method. And these drugs are also mild inhibitors of monoamine oxidase, the enzyme that's involved in the catabolism or the degradation of these neurotransmitters. From a pharmacokinetic standpoint, amphetamine can be given either IV or inhaled. Typically, we see absorption from the GI tract leading to metabolism by the liver. These drugs are excreted in the urine, so urine analysis or tox screens can show these drugs. The euphoric effects on amphetamine last about 6 hours, which is 4 to 8 times longer than cocaine. In contrast, methamphetamine, we said, is the most potent amphetamine. The duration of action is much greater than cocaine. The routes of administration include IV and smoking, which gives a rush or a flash sensation. Oral or intranasal administration, however, just produces a high, does not produce a rush. Amphetamine and amphetamine-like drugs have some therapeutic uses. These drugs are sometimes used in the treatment of narcolepsy, a sleep disorder with episodes of uncontrollable sleepiness during the waking hours. The increased stimulation of the CNS by the amphetamines enables such people to remain awake. Paradoxically, amphetamine-like drugs also help treat attention deficit hyperactivity disorder, ADHD, a behavioral disorder characterized by inattention, hyperactivity, and impulsivity. The benefit derived by affected children is unclear, but they show an improved ability to concentrate and are less distracted by impulse. Meth also reduces the amount of saliva. Patients then tend to drink lots of sugary soda because they have dry mouth. The hallucinations that insects are creeping on top or underneath their skin are also associated with meth users. Sometimes they will scratch or pick at their skin, covering their skin with open sores. The changes that occur in the brain due to methamphetamine administration can be quite dramatic and can last for a very long time. These are PET images of dopamine receptors from controlled human subjects, from Parkinson's patients, and from abstinent methamphetamine users. The average period of abstinence about 3 years. And so you can see definitely the methamphetamine compared to control obviously has a much dramatic reduction in the overall number of dopamine receptors. There are several adverse effects with amphetamine. You see insomnia, irritability, delirium, elevated panic states, the production of cardiac arrhythmias, hypertension, circulatory collapse. There's something called amphetamine psychosis, and that's coming from chronic or long-term use of amphetamines. So then to quickly summarize, in terms of the therapeutic uses of methamphetamine, it's quite limited basically to the treatment of narcolepsy. Methamphetamine adverse effects are long and numerous listed here. Acute effects, increased wakefulness, decreased appetite, increased respiration, and euphoria, in contrast to the chronic effects, convulsions, anxiety, paranoia, hyperthermia, extreme anorexia, and cardiovascular collapse. And just to reiterate, there are no effective treatment therapeutics or strategies for the treatment of amphetamine type use disorder.